Welcome, everybody. Opening ceremonies. Do the Pledge of Allegiance. Everybody stand with me. I pledge allegiance to the flag of the United States and to the republic which one nation under God, indivisible, with liberty and justice for all. Ms. Teresa, do we have a roll call, please?
Commissioner Matthew,
Here.
Commissioner Hoffmaster,
Here.
Commissioner House, Commissioner Leininger,
Here, getting a donut. Yes.
Commissioner Baker,
Here, not getting a donut.
Commissioner Lanius.
Here.
You.
Very good. We have an agenda before us. Can I get a motion on the agenda?
Make a motion to approve the agenda as presented.
Support. We have a motion and support. Any discussion? Seeing none. Open up for a vote. All in favor with an aye?
Aye.
All opposed the same. We have an agenda. Item letter D, approval of the minutes for January 25th.
Move to approve the minutes as presented for January 25th.
Second.
We have a motion and support. Any discussion? Seeing none, we'll open it up for a vote. All in favor with an aye?
Aye.
All opposed the same. Our minutes are approved. Number 2, public comment. So this is where we will open it up for any public comment that is out there. All right, seeing none, we'll close public comment for the time being. Move on to Director Burns's Health Officer report.
Okay,
You're up.
good morning.
Good morning.
So I wanted to start by recognizing James Young, who is a staff member here at the Health Department. We missed James in our recognitions of service time. And so we are recognizing him today, 15 years of service with the health agency. He is in the environmental health section, was recently promoted to environmental health supervisor. And we want to make sure that he gets properly recognized. So we will get this certificate to him, both Commissioner Hoffmaster and myself both signed it. So, all right. The infrastructure grant, the bids have been collected. The painting board is again on the agenda today. And then carpet bids were reviewed at the finance committee meeting, and the agency has made a recommendation for one of those bids. With regards to our staffing update, environmental health, we have a sanitarian position in Coldwater that's been filled, and that individual starts on February 26th. In personal health and disease prevention, I want to welcome Heidi. Heidi is a clinic supervisor currently here in Branch County, and she officially takes on the role of the director on Monday. So she's a little early getting here, but I wanted to give her the opportunity to experience a Board of Health meeting and be here. So we are really excited to have Heidi in that role. She comes with lots of experience, has been our immunization queen, so to speak, and she's going to do great. So the position that Heidi is vacating has been posted, and she will be working to get that filled. In administrative services, the human resource support specialist position has been filled. That person also starts on February 26th. And then the emergency preparedness coordinator position, we have made that offer, and that person also begins on February 26th. So,
Wow.
Yeah, lots of new people starting on
How
Monday.
many of those were outside hires?
The EPC's outside, the HR is outside, the sanitarian is outside. So everybody except for Heidi.
So now you'll have one interior position.
We've got that position. Are there any others? We still have a part-time nurse job posted. Anything else?
There's an EH sanitary position that's being vacated next
Oh.
week.
Yes, we did have an EH sanitarian over in our St. Joseph County office who's leaving us for Kalamazoo. I think Paul's going to talk a little bit more, so I won't steal your thunder. Kindergarten oral health. So Chris Dewey, our health education and promotion supervisors, are working to gather information on existing COA programs, other local health departments. This was an effort that the legislature put in place a couple of years ago. There's some funding there. They offered it up on a those who wish to participate kind of basis, and some local health departments did choose to participate. So Chris has been working to gather information about those programs so that we can basically pull all the information together, look at the funding that's available to us currently, and make a decision on if we are going to be able to run the program locally. There is an intent that every kindergartner will have an oral health screen by this coming fall. So, okay. Agreement with Hillsdale Hospital, a little update. I did check in with JJ Hodshire at the hospital, and they are still full steam ahead on getting approval. They have hired a nurse practitioner, so that's good news. And identified the driver. I think I mentioned that previously. Their startup date is now first week of June, if approved by the accreditors. Community health needs assessment by Beacon. I've been asked to participate in that process. Beacon Health Systems is our Three Rivers hospital. They own hospitals in Indiana as well as in Michigan. And they are required to conduct a CHNA every 3 years. I am looking forward to that process with them. Staff education and training, we are bringing MERS in to provide staff with educational sessions on retirement programs that we offer, and they will be coming in soon. Health education and promotion is also working hard on our annual staff training day. That's scheduled for April 26th. We will have a time management presentation that day, and I think maybe we've narrowed down another speaker since then. Yeah.
We're still working towards it.
Still working on it? Okay. So we're working on making that a good training day for our team. Public health concerns, wanted to talk again about the bill package on lead. It was reported favorably from the House Health Policy and awaits a vote by the full House. That may have changed since I've typed this. The bills would amend Part 54A, lead abatement of the Public Health Code, and revise the threshold considered an elevated blood level in children, and to change the requirements related to lead abatement and mitigation of certain buildings and activities. So we anticipate with the updates and changes here that we will see more kids that are lead burdened and require nurse case management. So we do have a second nurse that's been trained now, and we'll see how that goes. May have to train more nurses in that regard. Respiratory illnesses, we continue to encourage vaccination for the flu and for COVID. There is currently an increase in flu in the state of Michigan, and we are not done with respiratory season yet. Haitian Creole speakers, in response to that increasing number of families we're seeing coming in from that to serve our Clemens facility here. We're working on adding translated documents. Our Health Education Promotion Department have been working with our clinical staff to get that done, and we have some products that have been put out. So, so that's good news. This is a challenging language. We have a translation service. That is something that we pay for. But when we dial up that translation service, Haitian Creole is difficult.
You need somebody from Louisiana.
Well, there you go. Yeah. So it's just an unusual and difficult to translate language. So really proud of my team on what they've been putting together there. Our City of Three Rivers action level exceedance. So not new information here again. City of Three Rivers, they have an action level exceedance in their drinking water for lead. That action level exceedance is continuing with their most recent round of samples. So we continue with filters for families and encouraging filtration of the drinking water there, providing education and information. And then I talk a little bit about health concerns in teens regarding health of teens experiencing unexpected health issues. And I'm gonna wait until I'm done here, and then I'm gonna talk a little bit about Quincy. So the Mouth Day at the Capitol is scheduled for April 10th this year. I do need to still call our local senators and representatives to schedule a time to meet with them that day. If anyone's interested in going, please let me know.
What's mouth?
MELP is the Michigan Association for Local Public Health. Thank you for asking. Yeah. So our Coldwater office, we continue to work with Branch County on upgrades to this office. They are intending to do upgrades to our restrooms. We have a counter in our clinic that they are intending to replace as well. That needs to be repaired. And they've also mentioned that they are going to be painting this building this year. So lots of plans from Branch County to make upgrades to this building. Schindler is still scheduled. They haven't been here yet to work on the elevator in Hillsdale. And of course, we have conversations today about upgrades to the Hillsdale building and Quincy. So let me just pull up my notes. Last week, Thursday, on the 15th, we had 2 parents of Quincy students come into our office and talk with our staff about their concerns regarding illnesses that their children were experiencing. We initiated an investigative process on that day, working with our regional epidemiologist, pulling together our team here at the health department. Since then, we've been in constant communication with Superintendent Creamer at Quincy Schools. We've had communications also with William Poole at the city of Quincy, who deals with their water supply program, and have been also working with MDHHS and Eagle staff members. We've had environmental health do a walkthrough of the school, and that was yesterday. Paul and Joe and did that walkthrough. There wasn't anything of huge concern found from that environmental walkthrough. So we are finalizing an initial health survey for parents. I think we actually have a survey that we're happy with this morning, and have just, I believe, received a list of students from Quincy that have these symptoms or some of these symptoms. And so we're going to start collecting information from that survey tool on those families. Our intention also is to put the survey into a secure format that can be filled out electronically with our state partners, putting that together, and then sharing that with all of families in Quincy. So that if they would like to complete the survey, whether their student had symptoms or not, we would be interested in collecting whatever information families wish to share with us. So that should be coming out soon. As far as the actual number of students affected, it's really much too early for us to have any number for you. And the initial survey tool will help us to determine that. And the investigation will take time. This is not something that we're going to very quickly be able to say, it's the, you fill in the blank, okay? There's been a lot of social media on this issue and a lot of concern. And if I were a parent with kids with these conditions, I would be very concerned as well. So it's all very understandable. And it would be very frightening to have a student with these type of neurological symptoms. So we certainly understand and empathize with those families. We are going to continue to work on an investigation that makes the most sense and is scientific, and try to come up with answers for families. But again, it is going to take time, and we will continue to work on it. Any questions for me today?
I do real. Yep, go ahead. Go ahead.
Sorry, Chair.
Yeah, go ahead.
I will
No,
urge to the chair first.
it's all you. Go ahead.
Can you share what those health symptoms are in Quincy?
So the initial reports were seizures, tremors, tics, and like
Okay.
twitches.
Right.
Yeah.
So,
Yeah.
Well, I want
Clarify.
Let's clarify the tic.
yeah, because
Well, and a tick bite may cause certain symptoms. So it's just much too early to be able to say anything is the cause here. But those are the initial symptoms that were relayed to us.
Did I mishear you? Did you say that we did get a list of
I think that was received late last night.
a list of
From the
children
school.
who have at least said that they've had these symptoms?
Well, this would be a list produced by the school. So the school is sharing information on what they know.
Okay.
How many was on it?
I don't have it in front of me, Rusty. There, I mean, I think it's less than 10.
Okay, that's solid.
Commissioner Matthews?
Thank you, Mr. Chairman. Health Officer, Ms. Burns, thank you for that report regarding the Quincy situation. You mentioned that it takes a while to get the report, research, and already our team visited in Quincy. I wonder, you will be able to reach the Michigan Department of Health and Human Services to expedite an emergency way rather than taking considerable time. You as a parent, I as a grandfather, we all concerned. So I urge Mr. Chairman, the health officer to contact our MDHHS. You have a good contact with them. I know of that. And also our local state senator and state representative, what involve them and what they can offer to our parents and our children and our community. Thank you. Thank you, Mr. Chair.
Thank you, yeah.
Did I hear you correctly? You were in contract with Michigan Department of Health and Human Services, correct? Okay,
Yep.
Yeah, we had a Teams meeting yesterday, and I think we probably had almost 15 MDHHS staff members from the environmental health section. So they're working lockstep with us to, produce a good survey document. They're the ones that are going to help us put it in a format that allows families to fill out that survey in a way that information is protected. So you can use SurveyMonkey, for example, to gather data electronically, but that's not a HIPAA protected data or survey product. But we will be able to do that using our resources in DHHS.
And I encourage once we get those surveys out to those affected, that those are quickly responded to, and then we're kind of we're kind of at the mercy of getting that data back so that we can actually use it to formulate some kind of solution, some kind of plan.
Yeah, I'm really just kind of looking for commonalities.
Yeah.
And that's kind of the first step, is to take a look and go, what do these kids have that maybe is in common?
Yeah.
And then we just kind of go from there.
Yeah.
So
Good.
Yep.
Well, I appreciate what you're doing. Go ahead.
Yep, you were in contact with Jonesville School, who now have a couple cases also.
We have heard from Jonesville Schools. I talked to the superintendent there yesterday, Eric Weatherwax. I wouldn't say that at this time in Jonesville we're actively involved in the same type of investigation, but we need to understand more about the calls we've gotten from the Jonesville family. So we're going to do some more checking.
Are they
into
similar
that as well.
conditions?
That's what I've been told, but again, I don't have all of that information.
Okay. Keep us posted on that.
I will.
Very good. Any other questions for the health officer? Nope. Okay. Moving on to our medical director's report, Dr. Libretto. Welcome.
My report is in the packet. So I guess a little different this month. My diversity in healthcare class, which is a lot, but very interesting that you can work in healthcare forever and ever and not really understand some of the diversity issues. Like I just had to do a little report on Black infant mortality and how it's 2 times that of white infants, even in parents with equal socioeconomic status and equal education. And so very interesting. And lots of policies that need to be worked on to kind of rectify some of those things. sat in on the interviews with Rebecca for the personal health disease prevention. So obviously, welcome to Heidi. And I attended a rabies webinar, which was quite interesting this month as well. Still working on our latent TB patients. Heidi's pretty paramount in that, so that's been wonderful, and we've got good communication. And actually, those patients are very compliant and want to do the right thing. So they're kind of easy to work with once we track everybody down. So that's been kind of a good thing. And then for my education this month, I felt like it was a little late to do something on the flu vaccine with the numbers still going up. It seems like the season's just a little bit prolonged this year. So we're still encouraging people to get their flu vaccine as well as COVID. So I thought I'd talk a little bit about the flu vaccine. And obviously we all know that the flu in everyone is different. So you can get the flu and be very, very sick, and your neighbor can get the flu and have a little cough and some sniffles and a low-grade fever and be fine. So in a way, that's why we encourage vaccination. So the vaccines work because we develop some antibodies toward the flu when we get vaccinated, and that does take about 2 weeks. So you have to remember during flu season when you're getting vaccinated that there's that empty little 2 weeks even after you've gotten your vaccine that you might be exposed to the flu and get the flu. And even with your vaccine, so people, I'll get this question all the time, right? I got vaccinated and I still got it. So you can still get the flu with your vaccine. However, I think what's important is this last statement: what protection does the flu provide to me? So there was a 2021 study that shows that vaccinated people were 26% lower on their ICU admissions and a 31% lower risk of death. So I think those numbers speak volumes about getting your flu shot, especially if you're immunocompromised or at risk. But we encourage everyone, it's over 6 months of age to get the flu. Last few years, there have been different ways to get it, depending on what age group you're in, depending on how immunocompromised you are. So we have a great staff here that will sit down and help you with that medical decision making, which vaccine you should get, your provider. So know that you. And then people always ask, how do they choose what goes in that flu vaccines? Well, the experts kind of look at the research, and it's a quadrivalent vaccine. So there's 2 against influenza A and 2 against influenza B in your vaccine. So they're taking their best educated guess of what's going to happen in that season. So we'd like to see people in September, October kind of get their flu shot, but even now in February and probably even into March, I would guess that's still going to be recommended because the flu season is still going. You can look at our numbers, and they took a little bump. They took a little bump after winter break for schools, and they took another bump. So they're a little higher than they have been in previous years. So important. And I don't know if that might be related to COVID when we were also isolated. The flu didn't get spread around as much, and we were masking, so respiratory things were kind of a little quieter then as well. So important to get your flu vaccine. And if you have any questions about getting it, important to ask, right? So people have all sorts of theories. I've heard I get the flu vaccine and I always get the flu. Well, you can't get the flu from the flu vaccine, although there is one live variant we use very rarely, but it's not a live vaccination that you're getting. So maybe, as I said, you were exposed to the flu right after you got your flu vaccine in that 2-week period, maybe you got the flu, but you fought it off really well because you were vaccinated. So those are all things to keep in mind. It's pretty rare not to be able to get vaccinated, previous allergy. That's about really it when we look at your risk factors for getting vaccinated. So important, again, to get vaccinated.
Very good. Thank you. Any questions for Dr. Lucarello? Real quick, so when we're consulting with Quincy schools and maybe Jonesville, is Dr. Lucarello in on those?
I have been in from the beginning, yes.
Okay.
Mhm. So the staff is very good. When parents showed up here to talk, we all got phone calls and we all got involved right away.
Good.
And I think the meeting with MDHHS yesterday was very valuable. There were some experts on there epidemiologists, things that we need
Yeah.
to know where to go from here. So I think the importance is right now case identification, because again, not that social media isn't factual sometimes, but there's a lot floating out there. So to separate
Yeah.
what we
Fact
really
from
need to start looking at and who's a case, right? Who's a case, who fits, to look for all those commonalities that Rebecca discussed. So
Yeah.
that's our first step.
Good.
And we're, obviously, again, I'm a parent as well, so I totally understand the necessity to kind of move this along and
Yeah.
figure this out for these families.
Absolutely. We all are. So we all have that
Mhm.
empathetic heart, and hopefully we
Mhm.
can, we're taking this seriously and we're trying to find some solutions. So it's good. Any other questions? Very good. We appreciate it, madam. All right, on to number 5, departmental reports. We have personal health and disease prevention. Miss Heidi, welcome. I know you're not throwing you in the fire right off the bat, but we appreciate you.
So here's your go.
You have a half an hour. Go ahead.
Point of the word.
This is not what I was told. There's no written report today for personal health and disease prevention, but we do have some statistics for you. The confirmed and probable case totals are there. We have some numbers on immunizations and referrals, and then on the back page, our WIC participation numbers. So Heidi will have a written report for us next month. It'll be her first one.
Well, we'll look forward to it.
Thanks.
We appreciate you being
Got
here.
her flags until Monday.
Yeah. Just make sure you have the agency song down.
Right.
Don't forget the secret handshake.
And the secret handshake. Very good, Paul. Speaking of Paul, environmental health.
Good morning.
Good morning.
As Becky kind of touched on earlier, we do have quite a few staffing changes that are taking place in environmental health. We hired a sanitarian to replace Jane, who was promoted to supervisor. Her name is Julia Bronson, and she started back on the 12th, and she's doing very well. We have another new sanitarian that's going to fill the new sanitarian position that was created. She will be housed here in Coldwater. Her name is Mackenzie Horsfall. She will be starting on Monday. So both Julia and Mackenzie come to us with really good backgrounds in science, biology, which is one of the things we really are looking for when we hire sanitarians, so that they're able to sit for the registered environmental health sanitarian certification. So really excited about having both of them on board, and it seemed like we just got everybody on board, and then we got one of our sanitarians over in Three Rivers has taken a position with Kalamazoo. So again, it's just one of those things where they're going to other counties because they get more money and get better benefits. And Bethany has been a really good employee for us. She started for us back in 2019. She started actually over in Hillsdale County, where she worked in both food and dental sanitation programs. And then when we had an opening in the Three Rivers office, she wanted to take that, and so we moved her over there. She's has been working in the general sanitation program since then. But Bethany's going to be a big loss. We're going to miss her skills and her very upbeat personality. She's just a fun person. So we're sad to be losing her. So that position has been posted, and we will start doing some interviewing for that position as well. So we have a lot of new staff coming on. So we're really trying to amp up the training as for the general sanitation program. We're approaching the busy season, and I think things are going to get busy sooner this year than normal, just because of the mild winter that we've had. None of the counties are going to have load limits, which really kind of slows down the septic work. That's the trucks that haul the stone and haul when the low limits are on. But we've had such mild weather that I don't think any of the counties are going to have load limits this year. So that could mean that we're going to start getting busy sooner. But anyway, we'll be working on getting folks trained up and getting on par to get things taken care of. The other thing I had in my report was on the Three Rivers ALE, and Becky already touched on that, so I don't think I'll spend any time on that. I did want an update on a couple of other things. Last month, I talked to you about an investigation that was gonna be that had taken place around the Lear Seeker plant in Mendon back in 2002, where they tested for PFAS, found quite a few homes that were affected. Most of those were within the village. Those have all been hooked up to the city water system now, so those are taken care of. There was one that was in the township that is on a filter, but we had a report from some folks that are also in the township outside the village limits that are not on municipal water. They were concerned about the water, contacted Eagle and MDHHS. They are reopening an investigation and going to expand that investigation. So they're going to be doing some testing on some of the homes, obviously that are still on water wells, not on the municipal water system, but some of the wells that were tested back in 2020, and they're including some new ones as well. And they're not only going to test for PFAS, but they're also going to be testing for VOCs, which are volatile organic compounds, and metals. They did some more investigation. They found that there's a potential for those types of contaminants to be in the area as well. So hopefully that sampling will start next month, and I will keep you updated on any news that we get on that, on those samples. So hopefully we don't find anything, but I'm pleased that Eagle and MDHHS have decided to expand that investigation to kind of calm the nerves of the folks that are dealing with some health issues there. And, you know, so maybe we can eliminate or maybe we can identify something that may be going on there. The other thing that I wanted to talk about just briefly is we were contacted by Eagle recently regarding a homeless encampment that was in Three Rivers. So Eagle was contacted by the Attorney General's office to look into this. Eagle passed it along to us to look into it as well. They had received reports of potentially sewage being deposited on the ground and trash. So we investigated right away. We did not find any indications of sewage anywhere on the site, but it was a mess. There was a lot of trash. So we wrote letters, correction letters to the folks that own the property, and have given them a time frame to get it cleaned up. In the meantime, it appears as though the people are not living there anymore. We had heard that the state and local law enforcement had gone out there and told people to move along. I personally went out there towards the end of last week. I did not see any activity from people. The mess is still there. But we have also contacted the township, and they are involved with their building and zoning people to help us get compliant as far as getting things cleaned up.
Is that Vegas?
Yes, yes, yes. And it's actually along beside the parking lot of Walmart. But Walmart doesn't own it. It's actually owned with somebody else. So, but anyway, we're working on that. Unfortunately, you know, these things are popping up all over. It's a really, really bad situation. These people have to go somewhere. They kind of anticipate that they're going to show up somewhere else around the Three Rivers area, and we'll have to deal with that when it comes. But very sad situation. Obviously, we can't allow unsanitary conditions to be present. So we will work to see what we can do there. That's all I have.
Did you have a chance to talk to the property owners?
No.
So we just wrote a letter.
Yes.
And so
yes.
Okay.
Yeah.
I didn't know how receptive they were to it.
We haven't heard back from them yet. One of my sanitarians sent them a letter, and the last I checked with them, which was earlier this week, hadn't heard back from them at all. So they've kind of been non-responsive.
How long a period did we give them to clean up?
To the end of this month.
To the end of this month.
So,
Okay.
yeah, so by the end of next week. So if nothing happens there, then we will forward it on to the prosecutor's office and try to get something up that way.
Okay.
Yeah. Like I said, the township is also involved with that, and the township building inspector is really good about getting compliance, you know.
The building or the zoning?
Zoning and
Was it Doug?
Building and zoning, actually.
Probably Doug Pullman.
Yeah, yeah. So,
good. Any questions? Go ahead.
Thank you, Mr. Chairman. I have two questions to Director Andriachi. That's number one. You have what, 10 or so management classes for food services?
yes. So no, we had one class with 10 attendees.
I see.
Yes.
Right. Number two, do you, pardon me, do you inspect school cafeterias?
I'm sorry.
Yeah,
School
yeah, they do.
cafeterias.
Yes, we do. Yes.
I wonder you will be able to review past 3 times we visited the subject we discussed earlier.
At Quincy.
Yes. In fact, we did a walkthrough of the cafeteria yesterday when we were there, and yeah, we have reviewed that, and really didn't find anything of consequence. To be honest with you, yeah. And so, yeah, that's that's part of one of the things that we look for. And there was stories out there that there was a pack of rats running through the cafeteria. So obviously, one of the things that we look for on our food inspections is evidence of rodents, insects, those things, and we didn't find anything there yesterday either. So yeah.
Go ahead.
It's more of a statement than a. Remember back in August, I told you I had a property amendment. They were drilling and checking PFAS. It's all starting to finally make sense. I mean, it's 2.5 blocks from their signature, so they were out and they had contracted out drilling core samples for PFAS. They're back last August.
Yeah, and who was doing those drilling?
They got.
Was it
I got
Eagle?
the business card. It was for Eagle. It was a
It
contract.
was for you. Okay, so it was a separate contractor. Okay, yeah, I was not aware of that.
So they've obviously been doing work there as early as last August.
Great.
Very good. Any other questions for Paul? All right. Thank you, Paul.
Thank you.
Moving on to Area Agency on Aging, Miss Laura Sutter, who is not here.
Yeah, so I'm pitch hitting, and then we do have Ashley here today, so I want to welcome her. And I'll just run through this and we'll see if you have anything you want to add. So Laura talks a little bit about the victims of elder abuse program and gives some updates there. She does mention that the Transportation Authority in St. Joseph County will be coming to this board for a contract amendment, and that'll be March or April. So just to get that on your radar.
What is that about?
The contract amendment. So when they apply for grant dollars, the contracts, they specify how they wish to use it, and they want to make some changes, some tweaks.
Yep, and I'm on that board too, on the Transportation Authority board. And essentially, the Transportation Authority is not going to ask for any more money. They're just asking for it's instead of it being allocated towards like curb to curb, we're going to have it. There's 2 parts, kind of like what Rebecca was saying. There's curb to curb, and then there's also medical transport.
Mm-hmm.
We're using quite a bit for medical transport, and we're getting allocated both buckets. We just want all to go for medical transport. We're not going to stop doing curb to curb. We just want all of the AAA grant to go towards one specific. So it's not going to change the overall dollar value. It's just how we're going to do it. Yeah. So
It's just more efficient,
Yeah.
I think, for the
Yep.
transportation
Yep.
department.
and they're going to bring together something for us. So that'd be good.
So there is today an annual conflict of interest and disclosure form at your place. It should be 2 pages stapled together. We do need you to sign that and give it to myself or Teresa today. This is an annual thing that you do, and we appreciate your completion of that form today. And then the Aging organization also does a day advocacy every year that is scheduled for May 1st. It's called Older Michiganians Day. And you are always invited and welcome to go with us. Laura always takes a contingent up there and also works with the local COAs to take up groups as well. And so if you are available and would like to attend this year, please let us know or let Laura know. And Ashley.
Thanks.
Welcome.
Thank you. Sorry I was late this morning. I have a toddler that might fall into the flu
Oh, no.
statistic. He woke up with a fever, so he's a little bit clingy. He didn't want me to get out the door. I'm Ashley Ellsworth, the field representative for Region 3C. For those that are new that I've not met before, I work closely with Laura on Older Americans Act funded services. So just a couple of updates today. The big one is the Administration for Community Living, or ACL. That's our federal. We have to. They kind of oversee what we do. They released the final rule to update Older Americans Act regulations. This is the first major overhaul for Older Americans Act since 1988. There have been some updates along the way, but this is the first major overhaul. If you want to look into it a little bit more, you can go to acl.gov/OAA rule, or just go to the acl.gov website and you can get there. But it has a nice little bulleted synopsis of key updates. Then there's another overview, but if you get real adventurous, you can read the over 450 pages of the entire rule, which I have not gone through yet. We are in the process of going through that, working closely with ACL and advancing states to see what impacts will be made to Michigan and service programs. The rule does take place on March 15th of this year, so soon, but don't freak out because you have until October 1st to implement it. So any regulated entity has until October 1st. And the ACLS Bureau, my team, is going to be working closely with ACL and Laura's team and all the AAAs across the state to help implement those and make those changes. So they're not just working through them on their own, because I don't think they're huge. There might be a few changes to the nutrition programs mostly, but mostly it's clarifications, broadening of terms, defining terms, and things like that. Because we know the world's changed a lot since 1988, not just COVID. Many other aspects have changed as well. So that's exciting, but also kind of a cumbersome process that we're working through. And the only other update is not even really an update. The federal budget, we have another continuing resolution. So ACLS Bureau submitted another, finding my words this morning, sorry. We gave out another SGA for a month of state and federal funding. I think that just came through yesterday. I think I saw an email come through. We're hoping a budget will be passed soon, but we're just kind of waiting and seeing at this point. Any questions for me?
Any questions?
Well, I do believe that award was through the month of February or through the month of March?
I think the one that came through yesterday would fund through March. And then depending on how things go at the end of March, another will be issued for April. So we're just unfortunately on month for both state and federal until we can get a budget. Depending on the continuing resolution, the way they're issuing them, we can't issue more than a month at a time.
Very good. Any other questions for Ashley? Okay, thank you so much. We appreciate it.
Thanks, Ashley.
All right, letter D, health, education, and promotion. Ms. Chris.
Good morning.
Good morning.
So just a couple updates. Our department has really been working and focused on planning and preparation, evaluating what we've been doing in the past and how we would like to shift and move forward. So I've been working with my team and they've been very engaged in the conversation about what does health education and promotion look like as we move forward. Again, we continue to maintain our social media presence, and we did issue 2 press releases in January. And so we appreciate our media partners who share information for us and on our behalf. The community health worker program is continuing, and a couple exciting things happening there. The first is that we have completed the community health worker certification process. So our community health worker has now been certified by MICHWA, the Michigan Community Health Worker Association, which was the first step for us to be able to get her accredited through Medicaid CHAMPS in order for us to apply for reimbursements for her services to the community. So we have completed that process. We've also completed our request for recognition as a provider to Medicaid, and hopefully we will have an answer on that application forthcoming soon, so that we can begin the process of reimbursement for services rendered. The greatest area of need for the month of January that Rachel worked on was food, housing, transportation, and health insurance, which, as you can imagine, probably correlates into some of the homeless issues we're seeing as well as just pressure on families as the public health emergency has unwound and folks are just trying to adjust to a new financial normal. As Rebecca mentioned, though, kindergarten oral health assessment, I would just like to add that we are including the required oral health assessment form from the state of Michigan for those families who have private dentists that will be taking their children to be evaluated, so that the parents can get that form completed and return to the school. And we will, again, are continuing to look at the program from the health department's perspective. Just a couple updates from the EPC side, since as of Monday, I will no longer be serving in that role. We will be having an ICS 400 course in this room next February 28th, so next week, 29th. That class has 15 students enrolled. We did partner with the Sturgis Chamber of Commerce and did a Stop the Bleed training for the chamber membership. There were 15 kits provided to the participants that day. Had a great time working with Jeff Baso over in that area to present that information. So I'm excited about that. We're still looking for partners that we can work with to extend that training program. The Health Alert team did form a tabletop exercise on February 1st related to a foodborne illness outbreak. The participants were very engaged in the conversation. We had a lot of good talk, and we identified a couple of opportunities that we need to look into further. But since we haven't really done an internal tabletop exercise because we were too busy in a functional response, it was good to kind of get back to that training. So thank you.
Very good. Thank you, Chris. Any questions for our health education promotion? All right. Well, thank you very much, Chris. Moving on, financial reports, Ms. Teresa.
Yeah, so good morning.
Good morning.
The bills are large this time, so I'm going to point out a few things to you. On page 29, you'll see Jurgens Piping. It's just a small bill, but that was for the drinking fountain in Three Rivers through that infrastructure grant, so that's a little bit unusual. Then a little bit further down that page, you see North American Rescue for $14,355. That was for the Stop the Bleed kits that Chris is using for the training she was just referring to. That was also paid for by a grant. And then the elephant in the room is the big thing down there, State of Michigan MDHHS for $468,446. That's grant money that they overpaid us for the last fiscal year that we returned to them. We were gracious enough to hold on to that for them and collect the interest, but they wanted it back, so we sent it.
We didn't have to pay that interest back to them.
No,
Win-win.
I know they asked me if I wanted them to not send the money for this year, even though if we weren't going to spend it, we could have them, reduce it. And I said, no, keep sending it.
Yeah. Very good. Any questions for Teresa?
Yes, I think I know, but I'm not certain. Page 29, State of Michigan,
We just went over that.
468.
Yeah, that's the grant money that was for COVID grants that we did not spend, that they wanted us to return the unspent money.
Do we have the potential to spend? Did we have the potential to spend that money? I know we've talked about in the past where sometimes we just don't. we just don't have the need essentially, and so we can't,
That's exactly.
and that's why there's no need for it. Yeah, okay,
We spent what we could,
okay,
I think. As a person.
okay.
Well, yeah, I mean, I don't like to spend,
Or spent what was needed.
Yeah. we'll
yeah,
see that.
grant dollars, they were taken away from somebody hardworking, yeah, fair dollar.
Sure.
And if I don't need to spend it, I would rather not frivolously spend it
Sure, thank you.
and give it back.
Yeah.
So,
Good. Any other questions?
Move to approve the January 2024 or payment as presented.
We have a motion and support for payments. Any further discussion? All in favor with an eye?
Aye.
Opposed the same? Motion carries. B, review of financials.
yeah, so you also have your balance sheet and your expenses by program. We continue to monitor how we're doing against our budget amendment. We're currently 6.44% under budget and monitoring things, nothing that I'm terribly concerned about. Be happy to answer any questions that you have.
And just to point out here, so Teresa, you just sent the state a check in January for $468,000.
Yes,
And on the balance sheet, you're showing due from the state of a negative amount of $62,159. So based on your projection right now, through the end of our fiscal year, we would have to pay back $62,000 to the state.
no, that's how much of their money we have right now that is
That-
not earned by us. So
Like-
it's going to continue to grow as the year progresses.
But like I said, if the fiscal year ended right now, based on the current fiscal year, that's what we would have to send back to the
Yeah.
state.
Like grant money, what do they send it monthly, quarterly?
They send it monthly. So most of our grants that we deal with, we get quarterly payments from them. And we fill out a quarterly financial statement that tells them this is how much money we spent, and then they pay us that amount of money. These particular grants were COVID grants, and they pay us 1/12 of the total awarded every month, whether we spend it or not. We still report quarterly to them, but they don't ask for it back until the end of
So the 62 is what they sent us, I mean, sorry, but it's what they sent us or what we have used out of what they sent us?
That's what we have not used out of what they've sent us at this point.
And don't anticipate, or, may not anticipate using, so right now, that fiscal year ended right now, we'd have to send that back to the state.
I mean, but if something catastrophic happened and we had to, gear up again and bring on some temporary staff again, and we would have money to do that.
If the need arises, we can use that.
Or have it not needed, need it not have it.
Yeah.
Move to approve the month-end financials as presented.
All right, we have a motion
Second,
and we have support. Any further discussion? All right, all in favor with an eye?
Aye.
Opposed, same. Financials reviewed and accepted. Committee reports. Finance Committee. We just had the Finance Committee.
Yes, we do.
It was amazing, as usual. We had lobster and steak, and everybody had an amazing time. Lanius and I,
On the banker's dime.
yeah, on the banker's time, we solved the world problems, and we will be bringing those problems to you guys as an overall board to further discuss and solve. So we'll have that. The minutes should be included. Teresa had the opportunity to
That stuff.
pass those out to everybody. So, pretty short.
I'd move for the final committee meeting minutes as presented.
We have a motion. Do we have support? We have support. Any further discussion? All those in favor with an eye?
Aye.
Opposed, the same. Very good. Okay, moving on to B, program policy and appeals.
Well, Commissioner Baker and I were present yesterday for the Program Policy and Appeals Committee meeting. I think we went longer than you guys did this morning. Your Finance Committee meeting, but still relatively short.
You guys had peanut butter and jelly.
Yeah.
we like to care of business, not just eat
No.
lobster.
No. Commissioner Bread and Water.
Okay, Fred, one. Very good.
And there will be some items underneath new business later on that we will be discussing. Yeah, and I would move to approve the Program Policy and Appeals Committee meeting minutes as presented.
And I'll second that.
We have a motion and support. Any further discussion? Seeing none, we'll take a vote. All in favor with an eye?
Aye.
All opposed, the same. PPE is accepted. All right, moving on to unfinished business. Number 8, letter A, interior paint project for Hillsdale. Ms. Rebecca Burns, we discussed this at length our last meeting. Go ahead. What do you got?
So the same item is back before you today. There was a request to have this placed back on the agenda, so it is there for you. The bids have all been made public at this point, and so hoping that, anyway, go ahead.
Commissioner, I would move to accept the bid from APEC Painting for the painting of the Hillsdale Board of Health office.
Okay, we have a motion. Do we have support?
For it.
We have motion and support for Apex Painting. Any further discussion?
Just clarification. At our last Board of Health meeting, it was mentioned that we have to have 3 bids. And after that meeting, we did receive a copy of the Board of Health procurement policy that was last approved by the Board of Health in 2018. And that procurement policy, as adopted by this body, does not require 3 bids unless it's over $150,000. That procurement policy was reviewed again yesterday at the Program Policy and Appeals Committee meeting, and we did not see any changes that needed to be made to that policy. The health officer and Teresa have reached out to multiple different companies looking for estimates. We received 2. Apex Painting was the cheapest of the 2, and that was the reason last month that it was recommended for approval, and that motion failed on a tie vote. So it's back before us this morning. We have 5 members here.
Yep. And I think one of the things that was mentioned last week, which I think was rightfully mentioned, is maybe having more board members here. We have a board member that's probably not going to be here for a couple months just because he's snowbird. But we do have Rusty here now who can offer an opinion as well. So I think that's good that we did bring it back to the full board. Yep. Go ahead.
I wasn't here last month. Did someone have a copy of the other bid? Or at least tell me what the number was, so I'm not voting on something that I'm only seeing one bid.
Commissioner Baker, if you, I don't know if you look online at the Finance Committee material, it was in, I do believe, the December Board of Health Finance Committee, or the January
Yeah,
Board of Health Finance Committee material, and it was about $500 more than the bid that we have in front of us. $544.
And I believe it was R&L.
NNL.
N&L.
NNL, yeah.
I was close.
Yes.
It's initials. Very good. Any further discussion? Okay, seeing none, we'll vote all in favor with an aye. Aye. All opposed the same?
Aye.
Okay, we have 4-1. Motion carries. Moving on to closed door session. Are we going into closed door?
Yes,
Okay.
Commissioner, and again, because Commissioner Baker is here and he was not here at the last meeting, I moved to go to closed session, consider materials exempt from discussion or disclosure by state or federal statute pursuant to Section 8 of the Open Meetings Act, that's 15.268, and Section 13.1B of the prison, which exempts from public disclosure information or record subject to attorney-client privilege.
I second.
We have a motion and support. All in favor?
Point of order.
Order. You're going to get in.
Probably. This requires a roll call.
Okay. Roll call vote, please, Ms. Teresa.
Commissioner Matthew,
Yes.
Commissioner Mister,
Yes.
Commissioner Leininger,
Yes.
Commissioner Baker,
Sure.
Commissioner Lanius.
Yeah.
All right. Yep.